In this video, we are going to see about the psychological disorder. The term psychological disorder is more frequently known as mental disorder or psychiatric disorder. Mental disorders are patterns of behavioral or psychological symptoms that impact multiple areas of life. These disorders create distress for the person experiencing these symptoms. In psychological disorder, there are 15 different types of disorder. Out of these 15 disorders, we are going to discuss about 4 main disorders. Stress-related disorders. Trauma and stress-related disorders involve exposure to a stressful or traumatic event. These are previously grouped with anxiety disorders but are now considered a distinct category of disorders. Disorders included in this category are acute stress disorder. Acute stress disorder is characterized by the emergence of severe anxiety for up to a month after exposure to a traumatic event. Some examples of traumatic events include natural disaster, war, accidents, and witnessing a death. Adjustment disorder. Adjustment disorders can occur as a response to a sudden change such as divorce, job loss, end of a close relationship, a move, or some other loss or disappointment. Post-traumatic stress disorder (PTSD) can develop after an individual has experienced exposure to actual or threatened death, serious injury, or sexual violence. Symptoms of PTSD include episodes of revealing or re-experiencing the event, avoiding things that remind the individual about the event, and having negative thoughts. Reactive attachment disorder. Reactive attachment disorder can result when children do not form normal healthy relationships and attachment with adult caregivers during the first few years of childhood. Symptoms of the disorder include being withdrawn from adult caregivers and social and emotional disturbances that result from patterns of insufficient care and neglect. Disruptive disorders. Impulse control disorders are those that involve an inability to control emotions and behaviors resulting in harm to oneself or others. Types of impulse control disorders include kleptomania. Kleptomania involves an inability to control the impulse to steal. People who have kleptomania will often steal things that they do not really need or that have no real monetary value. Pheromania. Pheromania involves a fascination with fire that results in acts of fire starting that endanger the self and others. People who struggle with pheromania purposefully and deliberately have set fires more than one time. They also experience tension and emotional arousal before setting a fire. Intermittent explosive disorder. Intermittent explosive disorder is characterized by brief outbursts of anger and violence that are out of proportionate for the situation. People with this disorder may erupt into angry outbursts or violent actions in response to everyday disappointments. Conduct disorder. Conduct disorder is a condition found in children and adolescents under the age of 18 who regularly violate social norms and the rights of others. Children with this disorder display aggression towards people and animals, destroy property, steal and deceive, and violate other rules and laws. These behavior results in significant problems in a child's academic, work, and social functioning. Oppositional defiant disorder. Oppositional defiant disorder begins prior to the age of 18 and is characterized by irritability, anger, aggression, and vindictiveness. While all kids behave defiantly sometimes, kids with oppositional defiant disorder refuse to comply with adult requests almost all the time and engaged in behaviors to deliberately annoy others. Substance-related disorders. Substance-related disorders are those that involve the use and abuse of different substances such as cocaine, methamphetamine, opiates, and alcohol. These disorders may include substance-induced conditions that can result in many associated diagnoses, including intoxication, withdrawal, anxiety, and delirium. And examples of substance-related disorders: alcohol, inhalant, tobacco, gambling disorder. Neurocognitive disorders. Neurocognitive psychological disorders are characterized by acquired deficits in cognitive function. These disorders do not include those in which impaired cognition was present at birth or early in life. Types of cognitive disorders include delirium, and delirium is known as acute confusion state. This disorder develops over a short period of time and is characterized by disturbances in attention and awareness. Neurocognitive disorders. Major and mild neurocognitive disorders have the primary feature of acquired cognitive decline in one or more areas, including memory, attention, language, learning, and perception. These cognitive disorders can be due to medical conditions including Alzheimer's disease, HIV infection, Parkinson's disease, substance or medication use, vascular disease, and others.